Hello and welcome to this short video on documentation of final diagnoses. I'm Dr. Ibrahim from the National Center for Health Information, and this video was specially made for doctors in Farwaniya Hospital. I'm going to be showing you how to use the new mode of discharge screen on your health information system for documenting final diagnoses. These changes were made possible with the help of Farwaniya Hospital Administration and the IT team. As clinicians, what's our role in documenting diagnoses in medical records? As the treating physician, you're the only one authorized to document diagnoses. The final diagnosis is the most important data element on the patient's chart. It will be used for continuity of care and sound communication with other healthcare providers. And through ICD coding, it will also be used to generate statistics that are essential for decision-making, setting health policies, and for medical research. When a patient is admitted, a provisional diagnosis is documented. During hospital stay, as the patient is examined and further investigations are done, a final diagnosis is reached. This will be documented at discharge. Let's take a look at the new mode of discharge screen on your system. These changes were made to enable you to document the final diagnoses in the best manner. As you can see, the final diagnosis is now divided into two parts, the principal diagnosis and the other diagnosis or diagnoses. The principal diagnosis. The principal diagnosis relates to one important question. Why was the patient admitted this time? The principal diagnosis is the condition determined to be the reason for admission established at the end of the episode of healthcare. The principal diagnosis is not the provisional diagnosis. The provisional diagnosis was sort of your best guess, the best educated guess based on your experience and based on the patient's presenting clinical picture of what could possibly be the diagnosis. However, as the patient stays in the hospital and you do your investigations and examination, you do reach a conclusive final diagnosis. The main diagnosis, which is the main reason for which the patient was admitted to the hospital, is the principal diagnosis. The principal diagnosis is not the symptoms and signs. It's not the abnormal lab or radiological findings. These should only be documented in a diagnosis field when no diagnosis has been established for the patient. Here are some examples. A patient was admitted with chest pain. The doctor suspects it's an AMI. So, upon admission, the provisional diagnosis was AMI. During hospital stay, as the patient is well examined and the investigations are done, we reach a final diagnosis of GERD. So the doctor documents the principal diagnosis at discharge as GERD. It would be wrong in this case to document the principal diagnosis as AMI, suspicious AMI, or to document chest pain. We do see these mistakes in the patient's charts, so please be careful. The principal diagnosis is not the provisional diagnosis. The principal diagnosis is not the manifestations. It is the final diagnosis that you document at discharge that, to the best of your knowledge, represents the reason for which the patient was admitted this time. Now, what if the patient was also admitted for chest pain? And at admission, the doctor suspected it was an AMI, so the provisional diagnosis was AMI. However, during stay, no definitive diagnosis was reached. It would be wrong, again, to document AMI as the principal diagnosis, or suspicious AMI, because this is not the definitive diagnosis. We have actually not reached the definitive diagnosis. Perhaps the patient left against medical advice. In this case, we can document the principal manifestation or the symptom and sign that the patient has presented with. In this case, it would be chest pain. When you do not reach a definitive diagnosis, please do not document suspicious conditions. Do not keep the provisional diagnosis. Document the symptom or sign or the abnormal finding that the patient has presented with. What is the other diagnosis or the other diagnoses? These are conditions that coexist at the time of admission or have developed during stay. But there is a very important condition. These conditions must have affected the clinical evaluation, must affect treatment, must have required investigation or care, or extended the length of stay, or increased the risk of complications to the patient. These conditions are called the other diagnoses and will be documented below the principal diagnosis. So the other diagnoses are all conditions that coexist at the time of admission or that develop subsequently during admission that affect the treatment received or the length of stay of the patient. Diagnoses from an earlier episode that have no bearing on the current hospital stay should not be counted as other diagnoses and should not be documented in this episode of care. A patient, for example, who's had a total knee replacement before, if this case or this event does not have any bearing on the patient's current condition, it should not be documented. On the other hand, conditions such as obesity, diabetes, and hypertension do impact the patient's health. They may increase the risk of complications, prolong length of stay, or perhaps require a different dosage of certain medications. In that case, these will be documented as other diagnoses. So what if you want to document this total knee replacement event? You want to say that the patient has had something in his medical history, although it does not have anything to do with the current episode of care. You still want to write that. You can do it in the notes section. You can do it inside your clinical notes. You can do it wherever you document the patient's medical history. However, these events or these clinical conditions that have no bearing on the current episode of care should not be documented in the diagnosis section. Sometimes we're faced with some special situations. You may be wondering what to do if you have two diagnoses that equally meet the criteria for a principal diagnosis. Well, in this case, any one of these diagnoses can be sequenced first. Let's take a look at this example. A patient presents with acute cerebral hemorrhage and hip fracture. Perhaps he's been through a road traffic accident. Well, in this case, the principal diagnosis can be the acute cerebral hemorrhage, and the other diagnosis can be the hip fracture. But it can also be the other way around. You, the clinician, should decide which one of these two is the most clinically relevant cause for admission this time. In this case, whichever one you choose as the principal diagnosis will be written down on top in the principal diagnosis field, and the other one will be the first listed on the other diagnoses. I would like to share with you some of the common mistakes we see in patient medical records. One of these mistakes is documenting multiple diagnoses in one field. The correct thing to do is to write only one diagnosis in each field. Another mistake is documenting a procedure in the place of the diagnosis. The procedures should be documented in operative notes. There may be another field for documenting the procedures done. You can write them in your notes, but they should not be documented in a diagnosis field. Instead, in the diagnosis field, you should be documenting the diagnosis for which the procedure was done. Another mistake is writing post-appendectomy, post-cesarean section, or post-condition. We see that frequently in medical records. Usually what the doctor means is that during this episode of care, during this admission, the patient has had an appendectomy. Instead of writing this in the principal diagnosis field, the doctor should be documenting the reason for admission, or the reason for which the surgery was done, which is acute appendicitis. Now let's talk about ICD-11 coding. Let's consider this case, a patient admitted with STEMI. You will free text the diagnosis on the left-hand side. Then, on the right-hand side, click on this icon to add the ICD-11 code. ICD-11 is much easier to use than ICD-10. It is not based on a specific list with limited options. Instead, it functions more like a search engine, more like Google, where you can type in your search terms, and receive search results from which you can choose the correct diagnosis. Let's try it together. Type in the diagnosis into the search box. You get these search results. Take a close look and select the appropriate one. In this case, it's acute ST elevation myocardial infarction. Then, click Save. This saves the code onto your system. It gives a message that ICD code has been saved successfully. Returning back to your mode of discharge interface, you can see that the entity of ICD-11 has been added on the right-hand side. We've reached the end of this video. Thank you for watching.